a few days ago, 7 patients were discharged from the isolation and treatment center at the University of Abuja Teaching Hospital. God willing, several more, we are informed, are set to be discharged in the coming days if all their tests come out negative. I once more wish to commend the efforts of the medical personnel who are working in the front lines of this battle. In the fight against this virus, the best weapon is prevention through public enlightenment and sensitization. This, as an administration, we have tried to do via stakeholder engagements with religious leaders, political leaders, trade organizations, and indeed traditional rulers. Following the presidential directive on the cessation of movement in the Fct and to other states, it is well known that we began full implementation of this directive, which has already largely been successful, except in some pockets of areas in some satellite towns, which we are working with the relevant agencies to make sure that this is taken care of. I want to also once more reiterate that the lockdown is meant to curtail the spread of the virus within communities. Violation of this directive will give us no choice but to employ even stricter measures of enforcement. There is a need for us to flatten the curve in the Fct as we continue on each day to record new cases of infection. We witnessed a dramatic rise in positive cases in the Fct. We have already put in place medical facilities that will accommodate this increase. The Asokoro District Hospital has now been designated as an isolation and treatment center that can cater for up to 100 patients with a large number of rooms which can be provided for intensive care patients if the need arises. It's very important for our frontline defenders and fighters for this disease to first and foremost be protected. And the training is concentrating on how they are going to protect themselves using the relevant equipment that we have already provided and are providing continuously. In addition to the Asokoro Isolation and Treatment Center, we also have the Idu Isolation and Treatment Center, which can accommodate up to 300 patients. And this facility is being largely furnished through private sector efforts. In addition to that, our general hospital located in Karu is also currently being retrofitted through efforts of the Federal Capital Territory, Fcta, as well as some other private donors, so that that place also will be able to give us additional space. As you know, other private sector organs under the presidential task force on COVID-19 are also upgrading other facilities. All in all, I think within the next few days, we should be able to really have available 600 bed capacity. I want to just reiterate the fact that in this fight, we all have to do it together. The greatest area where we need to disseminate to the general public is the fact that we have to really emphasize personal hygiene as indicated by all the medical personnel. Frequent hand washing with water and soap under flowing water, use of sanitizers where this water is not available, but above all, social distancing. That is the key. Finally, thank you very much, Chairman and Vice Chairman and of the Ministerial Advisory Expert Committee, as well as all those who have been working on this matter day in, day out. Thank you very much indeed.